Welcome back, dear viewers. And today we have a really inspiring guest with us. He's going to talk about early detection and management of liver diseases that are crucial to prevent severe complications and improve the quality of life. Regular medical checkups and awareness of risk factors can significantly help. So let's all welcome Dr. Ghanem Alsalem, a consultant in gastroenterology. So welcome on board, doctor.
Good morning, Yusuf, and good morning to our viewers. And thank you for having me as a guest here. Thank you very much. I don't think I'm a guest. I'm a part of the family of this program. And it's a famous Good Morning Kuwait is a very popular show. It's been watched by different people in Kuwait. And we welcome those who are English speakers in Kuwait to watch this program on daily basis, which is significant. And thank you again and again.
Yes, mashallah, doctor. It's such an honor to host you on KTV2 and also on Good Morning Kuwait's show. So let's start by asking you, how was your experience in life and how did you reach this stage as a doctor?
Oh, that's a good question. See, it started when I was young. You know, in Kuwait we have this culture when you are good in school, people will say, this is the new doctor, this is the future doctor. So this is implanted in my brain, and I started to look into it at a younger age, and I liked you know, the doctor job. And moving on with my studies, I got scholarship from Kuwaiti government to study abroad to do medicine, and alhamdulillah I was successful in that. Graduated from Ireland, and then I joined Kuwait back again in Kuwaiti hospitals, worked a lot, and then did my postgraduate studies specializing in medicine, and then after that to subspecialize in gastroenterology and liver disease. Alhamdulillah, I scored very good marks during my undergraduate and postgraduate, and now here I am doing my job as a consultant in this field, doing my best to help my patients and doing my best also to spread the medical knowledge across our society, our people, where we actually need a lot of medical knowledge in our society, not only in Kuwait, in the Gulf region, actually in all over the world. It doesn't mean that if you are living in the West that they have more medical knowledge than the East. It's the same. People need to get to know more in the medical field than anything else, because it affects their life and their health.
Yes, mashallah. That's very nice to know about you, doctor. And so today we're going to be talking more about the liver and what does it do to the body.
Oh yeah, it does a lot.
And why is it important for us to take care of it? And dear viewers, if you don't know, the liver is actually on top of here, right?
On the right side.
On the right side.
Okay. We were talking about it just early on about people would think it's on the left side. Some people think it's on the middle. It's actually the liver occupy most of the right side of the abdomen or the tummy, let's say, and it's spread a little bit in the middle. It's like it's one of the hugest organ, one of the largest organ inside your body. Is actually the second after the skin. So the skin is the largest organ, and then the second is the liver, and the most huge organ inside you is the liver. So liver is very important and located in a very right place in the right side. And Allah subhanahu wa ta'ala made us in a mechanical way that it actually has to be on this side to serve what is being made for.
Yes, subhanallah, mashallah. So for our dear viewers, how can we maintain a healthy liver in our lifestyles?
That's a very good question. And it's very important for our audience to understand, and viewers, to understand that liver is some organ, or is one of the organ you need in the body. You cannot live without the liver. So the liver needs to be healthy. And to maintain a healthy liver, you need to maintain a healthy life. Yes. And a healthy life includes that you sleep well, sleep at night, don't sleep in the morning, sleep at the night time. And you need to eat well. That means you have to eat healthy food, fruit and vegetables mainly. Avoid carbohydrates as much as you can, and fatty food. Fast food is not good for your liver. And you need to avoid unnecessary habits. For example, smoking, drinking alcohol, or a sedentary life without an exercise. That gives us the fourth point, where you need to have an irregular exercise. These are the four factors maintain a good, healthy liver. And just repeat them in a quick way, that you sleep well, eat well, avoid bad habits, and do exercise. one more thing is to keep the
Yes.
healthy liver. The studies are showed that drinking a cup of coffee, black coffee, every day actually gives the liver a good way of maintaining a good function and a good healthy liver. One cup can actually proved that it avoids liver damage, avoids and reduce the risk of having liver cancer, avoids the risk of having liver cirrhosis. And that is a very good way, a good habit to have is a cup of coffee every day will be good for your health.
So, doctor, what else other than coffee and caffeine can we also take?
Yeah,
day?
sure. Been asked this question a lot in the clinic, and sometimes people send me messages about social media talking about detox and things for that for the liver. Let's say something. Your liver can do the detox by itself. You don't need to help the detox for the liver.
Okay.
If you are healthy, you don't have any medical disease, and you are maintaining a good life, exercise, and eating well, you don't need to take detox to improve the liver function. The liver itself detox itself by itself, and that's a feature being given to it by Allah subhanahu wa ta'ala to maintain its good health. The liver, it's a huge, and it can it can maintain itself in a very good standing position regardless of your age and regardless of your if you expose it to a different substance.
Yes.
But avoiding bad things
Okay.
will help the liver. Not taking things will help the liver. So avoiding, for example, hormonal takes. Those who do go to the gym, sometimes they abuse the
Yes.
drugs. Those who abuse all kinds of drugs for
Yes.
unnecessary reason, they will may damage the liver. A drug overdose sometimes when you take things unnecessary without the prescription or without the follow-up with the doctor may
Yes.
damage your liver than anything else.
Yes, so doctor, we talked about medication and supplements and how
Yes.
can they affect the liver, right?
Yes, sure.
So how often should one get a liver test, and what do these tests involve?
Yeah, sure. So the liver itself has markers, let's say, in the blood test where you can actually look at the liver. Also, the liver can be looked at radiological point of view by doing ultrasound or CT scan or MRI or fibroscan. So these are different things we can do for the liver for testing to see the function, the position, the shape of the liver, and to assess the liver in general. But usually,
Yes.
we advise everybody to take a quick test or routine test where you do a blood test to look inside your body. So that will include one of these blood tests is your liver function test or liver function or liver test or liver chemistry, we say.
Right.
That way we test the enzymes or the production of the liver inside your body. And we look into it, see if they are high or they are low or they are on the level where they should be. And from there we take it and we see if we see any abnormal test, then we
Yes.
will move on for further tests where they are specified only for the liver to test the liver more often. So in general, we advise everybody to make, if they are especially of the age 40 or 45, to do a routine test where they go to the polyclinic, Mustawsif, or they can go to the hospital, or they go to the doctor to look into their body function in general. So they will
Yes.
look into your blood test, they will look into your blood pressure, they look at your sugar, and then part of it is testing the liver. We advise them to do that on a routine basis every year once if they are healthy. That's fine. But then we have these special people who are actually having chronic diseases. For example, they have fatty liver, or they may have actually diabetes, or they have blood pressure, or they have heart disease or kidney disease. These people will sit with their doctors and they will have a different scenario. They may have the blood test every 2 months. They may have the test every 3 months. They may actually have their test every week. So it depends on what's their clinical background or what the kind of diseases they have. The other thing is people who are actually on medications. Sometimes you take medication for a short period of time.
Yes.
For example, you may take steroids or corticosteroids for a short time, or maybe antibiotics for a short
Yes.
time. They may look into your liver test. Those, especially young, healthy, who may take medication for the acne,
All right.
they are heavy medications sometimes on the liver, so you need to
Yes.
test the liver on regular basis until you finish your course of the treatment with your doctor. So these are the special patients or special group of patients. In general, we advise to maintain good follow-up with your doctor, even if you are healthy. Some people, they have this misconcept: if they are healthy, young, they don't follow up with the doctors. No, I advise them always to have a time to go to your doctor, sit with the doctor, look at your vitals, look at your blood pressure, look at your sugar, look at your cholesterol, look at your liver function, look at your blood, because these are the measures. We measure your life and maintain a good biological life for your body.
Yes, mashallah. So Dr. Ghanem Alsalem, also water plays an important role in cleaning the liver, right?
Yes.
So for our dear viewers, we would like to know, how much do we have to drink water per day?
It's a common question, actually. Let's tell you this. Now, maintaining well-hydrated body is maintaining a healthy body. So you need to be in a healthy supply of water, fluids in general, especially in our climate. Here in Kuwait, in the Gulf, we have a very hot summer. We actually have very short period of winter, a very short period of rain. So most of our days are hot, sunny, and you need to maintain a good hydration to your body. So taking water in general is a very good and crucial for maintaining a healthy life and healthy body. Now, the amount of water you need to take on daily basis, there are no really good studies to prove it, but in general we advise everybody to take between 1.5 liter of water to 2 liters of water daily basis. That's my advice to all my patients. Now, you don't count the other things you take as a fluid. For example, you don't count the tea or the coffee you take every day. Take a water from 1.5 liter to 2 liters every day. That will maintain a very good healthy body, will help you a lot to avoid a lot of diseases and a lot of complications.
That's very nice to know and very interesting, to be real. So another question is that how can we spot people that have liver symptoms, or how can a person know that he has something with his liver?
Yeah, see, the liver can come with nothing. Patient will be fine. They do just routine check, and then they will find they have, for example, raised liver enzymes, and then we'll start to look into why they have a liver problem. Or they can come with complications of liver disease. So the range of symptoms patients may have varies from nothing to complications. But in general, we advise all the patients who feel tired, fatigue, they feel, they are not like before, they feel more tiredness, they should check their liver. Some patients may have actually jaundice, that means the skin come yellow, or at least the white stuff in your eye become yellow discoloration. Your friend, your family will look at you and say, you look yellowish a little bit. So that's indicate there may be a problem in your liver, then you have to look into your liver. Easily bleeding is kind of a symptom of liver disease. That means if you just get a small trauma, you think you bleed a lot under the skin, or actually your blood comes out, flushes out from a wound, like from your teeth or from your any part of your body. You think it's more than usual, then there may be a problem in your liver. You have to look into it. Itching is one sign or one symptom of having a liver disease. Other things you may do actually, or you may have distension, or your tummy looks like more huge than anything else. Maybe there is a fluid, not air, bloated maybe air, but that's a fluid. You feel some fluid inside your abdomen or your tummy, then that could be a sign of liver disease. Your lower limb, your legs, your feet, maybe get swollen more than anything else. You think, putting on shoes, you think they are, the shoes are smaller than the size before, or you can actually spot the swelling inside your lower side, and then that could be a sign of a liver disease. So these are, the common, let's say, symptoms of liver. Some patients may come actually with complication of liver disease. They may actually lose weight. They think they have lost weight, a significant weight. People look at you and say, you lost significant weight. Or sometimes you lose your muscles. You think you are more, you don't have your muscle in the cheeks, or you have your hand muscles, or your limbs. You think they are more thin, or a muscle waist, let's say. Other complications may be severe abdominal pain. You have tummy pain too much, and you cannot tolerate that pain. It could be coming from the liver, or sometimes you actually vomiting a blood. That could be a complication of liver disease. That's in general.
God forbid, and keep us all healthy, inshallah. So talking about physical activity, how can this contribute to making a healthier liver? Yeah, sure. See, the lifestyle we actually encourage people to do,
kind of the lifestyle at the moment we are living, coming into winter time in Kuwait.
Yes.
More camping and more people go to deserts and start to have mukhayamat and stuff.
Yes.
So they eat a lot at night and they don't do exercise a lot. Okay, I'm advising them to change that lifestyle. Hopefully they can do with this kind of nice weather to start to more experience the exercise outdoor, walking, jogging, or we have a lot of places here in Kuwait that are beautiful.
Yes.
Hadiqat al-Shahid, for example,
Yes,
Shahid
mashallah.
Garden, or just walking around the sea or around your house, around your neighborhood. It's excellent weather to do. So exercise should be part of your life.
Yes.
And even if you say, summertime is not nice weather, you can do in the malls, you can do it at home, or you can join the gym. Joining a gym or doing exercise on daily basis, half an hour a day,
Half an hour a day.
half an hour a day, five times a week. So you have 7 days of the week. Just
Yes.
give me 2 days a break, and 5 days you need only half an hour.
Okay.
That will make a lot of changes in your body.
Yes.
First, they will improve your circulation.
All right.
2, they will improve your heart rate, your blood pressure. 3, you will lose the weight, unnecessary weight. You will reduce the abdominal fat or the fat near the tummy, and that will reduce the pressure on your body. They will maintain your metabolic balance inside your body. Liver can maintain a good, healthy life if you give the liver good exercise. That means the liver will have more blood supply. They can do the function very well. The other thing is they reduce the fat around the liver. The most common disease we see here in Kuwait at the moment is the fatty liver, where the fat actually surrounds the liver, and the fat with time filtrate in or invade the liver tissue, invade the liver cells, and they make them fatty liver. And the fatty liver, when you have it, it's not nice, because within like 5 years, 10 years, 20% of those patients who have fatty liver, they may actually develop liver cirrhosis or liver fibrosis, and then they will have damaged liver. So to avoid this, there are no really medication at the moment to help in that. I know there are new medication coming now in the market will help, but the best medication is your simple, free, just exercise. See,
Yes.
you don't have to pay money for that, and you enjoy your healthy life.
That's perfect, Dr. Ghanem Alsalem. So we would love to also ask you, what about people with impairments? In brief, how can they practice this physical activity to avoid liver damage?
Well, they can have their own way of maintaining their liver healthy with different kinds of exercise. Exercise doesn't mean that you only walk, or you can take a swim, you can play a kind of sport you like, you can use your upper limb exercise, you can do, at the moment, actually this things came in my mind just when we were talking. At the moment, we have these small children and young age,
Yes.
where they lose their physical activity. They are sitting down, having their laptops, or they have their technology, and they don't do much exercise.
Yes.
You can use technology to make exercise. You can make the technology where they can interact with the technology and make activity
Yes.
with them, moving around or do some exercise with the technology, and that will improve them. Or actually you can give them time where they can stop from the technology and start exercise.
Yes.
So doing exercise for all kinds of people or generation should not prevent you, and you should not have an excuse not to do
Yes.
exercise. There is always a way to find it out and figure it for yourself.
Yes, mashallah. So Dr. Ghanem Alsalem, do you have any advice for our dear viewers?
Yes. First, I have to say, take the information from a good source.
Yes.
And the Ministry of Health in Kuwait here, they are very active in social media. You can easily access them. In Kuwait, we have really easy access to your doctors, either in the private sector or in the governmental sector. So don't rely on rumors, don't rely on social media for unnecessary information. Try always to take the information from a good, reliable source. Second advice for our viewers is maintain healthy life to avoid unnecessary complications. Healthy life, very simple: sleep well, eat well, and do some exercise. And I hope the best for everybody to enjoy the weather, and thank you for having me on.
Thank you, mashallah, doctor. A very informative interview for our dear viewers and for all of us here.
Thank you.
So I'd like to thank you again, Dr. Ghanem Alsalem, a consultant in gastroenterology, right?
That's right. You said it right.
Thank you very much. And now, dear viewers, we'll move to a new report with